Hi everyone! We are excited to talk about gender transformative global health research, why it is important in our field today, what are some of the challenges and best practices that we can apply to ensure that gender outcomes in health are ensured and that women's participation is maximized in global health programming, especially in developing countries.
Hi everyone, my name is Darlene. As mentioned by my colleague, we're going to be focusing on the issues that women face when it comes to partaking in research studies, as well as the issues that they face when it comes to becoming a researcher.
Before we delve into the content of this report, I would like to introduce us on behalf of the team. My name is Chloe Kayabyab. I'm a domestic violence researcher and a gender justice intern for World Renew, and Darlene herself is an educator, a coordinator, and a global health enthusiast. There is a lack of global health data among women in vulnerable populations, especially in countries that belong to the global south, that could inform both global and their own national health policies and improve the services that they have. Women suffer from different diseases, both non-communicable and communicable, such as HIV, AIDS, maternal and reproductive issues, and this has been exacerbated by the lack of services and even further by this pandemic. Conducting gender-specific research comes with different dimensions of barriers, both for the researchers and those who are being researched. Being a female researcher, on the other hand, in developing countries and in vulnerable regions like conflict-stricken areas, it's definitely no easy task with all the cultural and structural barriers that are in place that can be really hard to tackle without systemic change. Which is why it's really important to undertake different strategies to overcome these barriers and meet the needs of the people who are being researched, as well as aiding those organizations that are trying to bring about change through their intervention.
Women are 2 to 3 times more likely to be infected with HIV/AIDS in sub-Saharan Africa. Not only that, according to the WHO, 60% of the new infections in sub-Saharan Africa are still among women. When it comes to maternal health, 830 women die from maternal health complications that could have been preventable. And not only that, but 99% of all maternal deaths are in developing countries. Now this makes you wonder, why is this happening? Well, women only make up less than 30% of the world's researchers. In addition to that, in Ethiopia, a developing country, only 8% of the women are researchers. Now this makes you connect both of the issues where you have rising number of health disparities, but then you have a low count of researchers who are women.
So why is gender transformative data in global health important? Before I answer that question, I'd like to first explain what it means to have gender transformative research, gender transformative work, and gender transformative interventions. It is important to also engage men in the conversation. So it's not all about addressing women's needs, empowering women, but it's also important to engage them in the conversation in order to understand the cultural barriers that are in place that prevents women from achieving their full economic and social potentials, that prevents them from participating socially and contributing to the community effectively. And it is important to have that kind of work because you want to actually tackle systemic barriers. So that includes making men more aware of these inequalities that exist. Global donors and international development agencies have expressed the need for research that can address gender equality, which is an important factor in health outcomes. In many developing countries, it's very hard to access services like maternal health and sexual and reproductive health services, medicine, or services that address communicable diseases such as AIDS, for example. So it's important to get people who lead, such as men mostly, who lead the communities, to understand and acknowledge the needs that exist, and also to encourage women to be able to access these services. And of course, with community efforts, it really helps them influence policies, both local and national, and especially in the field of global health. So while a lot of research in global health is already being done, there's a lack of gender-based analysis on data, gender and sex disaggregated data that leads to a lack of gender sensitive policies and programs. So there are a lot of health programs, for example, in the context of COVID, but they're not gender sensitive. They address COVID as a whole, but do they address what needs women have despite or prior to COVID? Because, for example, access to contraception and maternal health services have worsened because of that pandemic. But health or global health as a field right now is just looking into addressing COVID as a whole. Gender is a social determinant of health, and the lack of data hides the gender issues that can actually influence these health outcomes.
There are many barriers to gender transformative global health research. We have economical, political, and social. The economical barriers are the ones that are faced by women who live in small rural areas, who do not have the means of being able to travel to different interventions or research studies located outside of the village. Then we have the political barriers, which are the ones that are faced by the women who do not have access to the necessary services or programs such as prenatal and postnatal care, which could help decrease the number of maternal deaths in India. Then we have the social barriers, which have been set up by society's ideologies, which deem women to be complicated, which is why they're not included in studies. And then again, women are said that they have demanding times, therefore the research studies are not willing to accommodate and include them within the study. It is necessary that women and gender experts are involved in the research process so that the gender equitable outcomes are ensured. However, this isn't the case for females who are working as researchers because they face many barriers, such as when it comes to working with supervisors. The supervisor prefers working with a male researcher as they are deemed to be professional and fit for the job and all the demanding requirements. Another issue that female researchers face is lack of sufficient funding to run a program or intervention, as they are deemed to be incapable or do not have the right amount of capabilities of being able to run or conduct research on their own. Lastly, women are not being given the same opportunities to progress forward or advance in their careers. They also are not given the chances to receive a higher level of education, which would allow them to align up with their male colleagues rather than being pushed down. The patriarchal system is both a determinant and a limitation that withholds women from participating in research or clinical studies. Why is this an issue? Well, men are taking decisions on behalf of women and determine whether or not they can participate in studies that could be extremely beneficial for their own health and well-being. Now, what does this further lead into? Now you are taking away the voices and power-making decisions of women who could be or help make a change for their own health and well-being. What's happening now? We're overlooking the cultural norms. We're overlooking the fact that a woman's voice is being hidden behind men. A woman's health needs is being hidden behind men. And now what is this doing? This is resulting into lack of inaccuracy of data or biased opinions because you don't hear the real voice.
Now we're going to be talking about the strategies and best practices in global health that help ensure gender equitable and gender transformative outcomes. Number one is to have gender balanced research teams. It is not only important to have an equal ratio of men to women, it's also important to have both men and women that are representative of the local community, a team that is diverse in terms of ethnicity, social class, country of origin, and many other identity markers that can help strengthen the research and make it more democratic and more representative, and of course to eliminate biases. And number two is to have a gender and women's health expertise. It's always important to check that the data is accurate and consistent with gender technicalities and health technicalities. And since it's women's health, having a women's point of view when it comes to health and health needs and outcomes, it's important to be able to coordinate both the gender and other social factors that can influence health and allow a women's health expert to translate that into the data. And three is to strengthen local partnership and also have male engagement in the process. As we mentioned, gender transformative involves males in the conversation. We want to also inform them as we do the study. Working with community partners and also consulting with other organizations that are experts in the field can help adapt the research designs to the needs of the local communities. Number 4, it is important to use the best research design, the best methods to gather the data. And especially for global health research and gender research, it's important to use methods such as key informant interviews and focus group discussions, because these are what make narratives authentic and representative of the women's needs. So you want to really involve women in the discussion. So it's more like participatory research. And these really help them, communicate the impacts of health on their lives and help organizations that make use of the study address their needs. Fortunately, the global health community has a lot of tools and frameworks that can help guide researchers as they conduct research in developing countries. One is called a framework to identify gender indicators for reproductive health and nutrition programming. As you can see in the slide, this can actually provide different researchers with already existing indicators that help measure health outcomes that are conscious of gender in their study. So it has a lot of examples provided there. Another one is on gender and qualitative interpretation of data that aids qualitative research to best tailor their study to the needs of the organization and the communities they're working with. So a lot of these we will be linking below for everyone else's information. And if definitely you're interested in one of these tools for whatever work you undertake in the future.
There are many recommendations in order to address the issues and disparities that have been discussed prior to this. First would be the process of conducting an interview with a female participant. It has been suggested and recommended that we turn that monologue into a dialogue. What does this do? It reduces the chance of making the individual be put on the spot or intimidating them. Rather, you want them to feel comfortable. Another recommendation when it comes to including women in research is prioritizing the needs and looking at institutions like the National Health Institute, who has dedicated to promoting research for women. Lastly, in order to collect sufficient amount of data so that we can address the needs of all these women, is to hire female researchers who can connect with the community who is being studied.